Hey, I'm Dr. Aaron Lungard. I'm the clinical director at Total Health Systems. Today I just really wanted to explain to patients and the public a little bit about what makes our facility unique. We are a multidisciplinary practice, and specifically when we're addressing musculoskeletal conditions, what is unique about a multidisciplinary practice like ours is we can combine specialties. We have our medical doctor on staff, we have physical therapists, we have chiropractors. So when a patient is coming in and they have a complaint of low back pain, for example, since that's a real common one, what we can do is look at why that low back pain is occurring, really address the underlying condition itself, and give you a specific diagnosis and then lay out that plan. The plan should include multiple specialties. We try, because of the type of practice we're trying to take drug-free approaches, so you're not going to see our doctor's prescribing a lot of medications for you. It's more about the hands-on treatments, getting to the root of the problem and correcting those problems so it's not something that cycles back on you and is going to recur. The chiropractic care, our chiropractors are really going to focus on one key element of your problem. Anytime there's back pain, neck pain, hips, shoulders, there's going to be joint dysfunction. You're going to have loss of joint mobility and joint range of motion. The chiropractors are really going to be focusing on improving and correcting the joint dysfunction. Then we have our physical therapy staff. The physical therapists are going to be looking at the other side of the coin. What moves a joint? Well, what moves a joint is muscle. And we have to look at anytime there's a joint that's not functioning properly, it's because there's dysfunctional muscle. And our therapists are going to be focusing on imbalances in the musculature. They're going to be focusing on dysfunction or trigger points, tight areas in the muscle. And they have to address two key areas of the muscle: the tightness and dysfunction, and then any areas that are weak. It's real common to see those muscle imbalances, and if the chiropractor only corrects the joint dysfunction and the muscle imbalances aren't corrected, more than likely that joint dysfunction is going to come back again. So we have to address both components, the joint and the muscle. Great example would be, if we just look at the bicep and tricep. Biceps and triceps are opposing muscle groups. Here's your bicep, it helps me curl my arm. Here's my tricep, it helps me extend my arm. If all I do all day is use my bicep, keep using that, my arm is going to become shortened and pulled inward. Not only is the bicep going to be extremely tight, what's going to happen to the tricep? I'm not going to be able to use it as well. It's going to be inhibited because of how tight that bicep is. That's a classic imbalance in the musculature. So if that bicep is tight, tricep is weak, what else is going to happen? It's going to start to affect the joints around it, the shoulder, the elbow. And these things would need to be addressed. You work on mobilizing the elbow, mobilizing the shoulder, working on the tightness in the bicep. Once you can do all those things, you start strengthening the tricep. Now we have a complete approach to a problem. Those concepts can be applied to any area in the body, whether it be the common things we see in this practice: neck pain, back pain, or a knee, hip. All these things can be addressed using this common approach of working on joint dysfunction and correcting muscle imbalances. If you're looking for those drug-free and unique approaches to addressing this problem, you can definitely find us online at www.totalhealthsystems.com or give us a call at our office, 586-228-0270.